Patty's a single mom of 3. She's home after a long shift. She's dealing with dinner and homework and the kids, and the phone rings. It's a care manager from Patty's health plan. She's behind on appointments and scheduling. The care manager is well-intentioned, but appears admonishing. And Patty hangs up feeling judged and not listened to and even more stressed. So Patty ignores her phone calls after that. None of her providers will know that Patty's car broke down, that she delays picking up her medications when the rent is due, that she struggles to keep food on the table, a roof over their heads, and her kids in school, that managing her diabetes is the least of her priorities until she ends up in the hospital. And for millions of people in low-income communities, this is how healthcare and daily life collide. And yet this conflict is largely invisible to the administrators, to the payers, providers, and policymakers, and the innovators ostensibly working to improve health. They're focused on metrics like transactions and encounters, on transactions that push people like Patty further away from the care they so desperately need. What's missing for Patty and for people like her is trust. So what if trust were the key operating measure in healthcare? My colleagues and I are working to build a healthcare delivery system for people with complex needs, where care teams meet Patty where she's at, in the way that is most comfortable to her, in her home, near her work, in the evenings, on the weekends, where we ask about and seek to address all of the barriers to well-being, not just the medical ones, where our incentives are aligned to support and sustain longitudinal trusted relationships, and where our technology is custom-built to enable those relationships instead of disrupting them, where our success is measured by our ability to engage, to collaborate with, to connect, to champion, and to accompany individuals on their own path towards health. Only when care is delivered within trusted and trustworthy systems, only then will we achieve better outcomes for the communities that are so often left behind. Thank you.